My name is Dean. I'm a recovering addict, and this is Inside Addiction. My guest today is Bill DeJoy, Clinical Director of Conifer Park. Bill, welcome to the show.
Thanks, Dean. I appreciate you having me.
23 million Americans suffering with addiction. That's a pretty significant number. On a conservative level, there's at least 3 people that either love or are affected and impacted by each one of those addicts. So add on 75 million people. We're talking a minimum of 100 million Americans that suffer with addiction or are directly impacted by it. Conifer Park has been treating and helping those families from adolescents to adults for the past 25 years. Approximate estimate, hundreds of thousands of people Conifer has assisted.
It's got to be. We admit about 3,500 people per year. So with that, if you take your 3 people that it touches, you're looking at pretty close to anywhere from 12 to 15,000 people a year.
Wow, that's awesome. I want to talk about first some of the reasons people go to treatment, some of the reasons people don't go to treatment, some of the symptoms and signs of addiction, and then the treatment options, which I've seen, Conifer Park I view as kind of a one-stop shop for treatment, from the newest program that you have, the Ambulatory Detox,
right,
straight through rehab, detox if necessary, outpatient, and even an alumni. So let's first talk about some of the symptoms and signs that someone may be able to identify within themselves or perhaps recognize in a loved one that, hey, there might be a problem. What are some of the signs and symptoms that you've seen throughout Conifer Park and throughout the population of people that are addicted?
Right. It's kind of a tough question, because I see in the inpatient facility the end, really, of the most severe and significant symptoms, but it's so much more minute and can be so much more subtle than what we see. So if you're talking about a problem at home, it might be you see someone's temperament change. They were peaceful, they were calm before. Now all of a sudden they go into anger and rage out of nowhere. You see problems with school, problems with work, maybe not showing up for work anymore or being late. You hear things like excuses being made for why they're not around, just being absent from family functions, new friends, places that they would go now that they wouldn't go before. You see just attitude changes, you see behavioral changes in them, and not for the better. The person who used to go to happy hour and have a couple of drinks and a couple of laughs, and the happy hour happened on Friday afternoon, happy hour is now on Monday afternoon.
Yeah, it's happy, turns into happy week.
Exactly. And the person who would drink on special occasions, or maybe get high on special occasions, as special occasion gets created more and more frequently, you start seeing these things where people lose time, where their brain just can't hold on to what happened that night before, things of that nature. And so you see things, people start slipping, and they can't keep up with what real life is supposed to be like. You see people's bank accounts dwindling. You see car accidents. You see maybe problems with the police, things like a DUI, things of that nature. When we start seeing folks at Conifer Park in the inpatient, now those folks might all go to our outpatient clinics and start to see a counselor there and work on their issues that they have. The folks that we see tend to have repercussions in their family. Maybe they have a significant other that says you can't come home until you go to treatment. Maybe it's the police or a judge saying you need to go to treatment, otherwise you're going to have this consequence.
Right.
So for our kids, I often say they're mom dated. So mom is telling them they have to go to treatment. But people don't generally wake up on a Tuesday morning and say, it's a great day for treatment.
It's a great day to go to Conifer Park.
You just don't see it. And so what you get are people who respond to something emotional in their life, something big in their life. And it could be, Child Protective Services getting involved. It could be truancy at school. It could be any number of things where somebody else has gotten involved and there's a critical situation, a crisis situation. And so people respond to that. And so they come in and they seek help, hopefully.
Now, actually, Conifer Park's website, I noticed the other day, actually has an online screening tool. I was checking it out on my iPhone. So tell me a little bit about that, because, how does someone navigate, especially with a loved one, without getting into that, that confrontational, intervention and overreacting and actually shutting the whole system down and making people, closing that line of communication? Because I've always thought, like, sometimes you got one shot at getting somebody help.
Right. And unfortunately, the media has created almost this glamorous picture of getting someone into treatment. And there's no glamour to it.
Yeah.
It's not a pretty picture. You've seen it in your life and with people you've helped. That little screening tool on our website is a really awesome thing. It'll take you, about 5 minutes? Is that about what it took you?
Didn't take me long.
Yeah. You learn a little more about yourself than you probably want to know. But
how many questions is it? And what are some of the questions that people can, what I love about it is people can take that screening tool in the privacy of their own home.
Right. I took it. And, I took it just as a guy who goes to work every day. And fortunately, I'm good. I'm okay. But, I took it then as maybe what one of my clients might look like or what they might act like if they were having a significant problem. And it showed, it was very real and very honest that, it doesn't say you need to go get help, but it says you might want to talk to someone. Mm-hmm. And that's the beauty of the screening tool, because it doesn't dictate the level of treatment that you need.
Yeah.
But it does inform you enough to say, yeah, you might have a problem. You need to...
There's some indicators here.
Yeah, you need to talk to someone. So it goes into things like school performance or work performance. It goes into relationship issues. It goes into, you took it. What'd you find?
I'm glad that I took it when I took it. If I had taken it July 6th of 2007, the day before I got sober, I definitely would have. It would have been a no-brainer. Yeah. And actually, I wished, often I see things that I, even as an adult now, it's like, wow, I wish that was around when I was younger.
Right.
That screening tool, I view it as, if utilized correctly,
and honestly,
honest, open, and willing, can, not even minimizing, I really think that could have the ability to prevent a lot of heartache in someone's life that's suffering, family's life that's suffering, if they're questioning it, if they think they're overreacting, underreacting, and has a potential to, because again, if you're taking a non-biased test, which was, developed by not a family member, I think people will be invested in it. I think it's a great tool.
I think so too. And I think you bring up a really good point, and I don't know if you even meant to, is that, 30 years ago, it would have looked really different for you and you wish this was around. Like anything, our technology has just gotten better and our ability to treat certain things has just gotten better. Not that long ago, we were saying everyone's got attention deficit disorder. Yeah. Every kid's got this. Well, you know what? Lots of kids do have it, but we're better at recognizing it now and we're better at the treatment of it now. We're better at the treatment of addiction too. We didn't have this screening tool 30 years ago. Right. It might have helped you through a lot of heartache. It might have helped your family through a lot. This tool is available now, fortunately, to maybe stop future generations from having to go through things.
So somebody takes that online tool that's available at coniferpark.com or identifies some of the signs and symptoms that we've talked about, whether they be work, or whether they be missing school, truancy, whether it's your girlfriend throwing your stuff out on the lawn. With all that in mind, what are some of the reasons why, 25 million Americans suffer with addiction, yet how many such the low percentage of people that actually seek and receive treatment? What are some of the reasons that you found or that you believe as a clinical director prevent people from actually getting the help that is available?
One of the things that I've definitely learned in my career, 20 some years now, I'm a social worker by degree, and so I've counseled people throughout my professional career, people don't like to look at themselves. There's a fear factor about looking inward at yourself and checking out your own demons, checking out your own problems. And addiction doesn't just happen. At Conifer Park, we really believe that addiction is really, the biggest part of addiction is really just the symptom, is what shows up. It's all the underlying stuff that you've got to treat.
Sure.
So you've got the anger about something. You've got the hopelessness, the helplessness, the depression, the
Trauma.
anxiety, all of that stuff. That leads to the addiction. A lot of people use drugs and alcohol as a way to cope with everyday stressors. And so they believe that they can't make it through without having a drink here or having a smoke there or maybe, popping an oxy there. Any of that, just so they can cope with life stressors. Then what happens, as we know, it goes further. Traffic light becomes a life stressor. That person at Walmart becomes a stressor.
Yeah.
Anything can become a stressor. The line too long at the deli, gets to be a stressor. And it's like, I can't deal with this. I can't deal with this. And so the anxiety gets ramped. The end of a relationship where when you're clean and sober, you might be able to tell when the relationship is ending. Usually relationships don't just, and so they start to fade and you can see when things are a problem. But an addict doesn't see that because they medicate themselves with these drugs.
How'd this happen?
Right. Why is she kicking me out? What did I do? So where once upon a time they were using for fun maybe, and then it became coping, and then it became all-consuming. And that's quick.
Yeah.
But there's a gradient to this and a progression to this, and it takes time to get there. So people use really to cover up a lot of stuff that's going on in their heads.
So if they stop using, how are they going to deal with that? So there's a reason not to go to treatment for many people.
Right.
I know my experience has shown me a lot of people too don't understand all the options that are available.
Right.
Because there's no cookie cutter approach to addiction. There's no cookie cutter approach to recovery. Some concerns that I've heard, in particular with women, who's going to take care of my kids? Oh, I've got a job, I've got bills to pay, I've got a house, I've got a car note. But Conifer Park, again, really offers a lot of different options, and it's not a cookie cutter approach. It's not you're an alcoholic, you drink, so you're going to go to rehab. You're a heroin addict, so you're going to go to detox. It's kind of, what the goal always, I think, has been, and people continue to move forward towards, is individualized treatment. So one of the newest services that you guys at Conifer Park offer is an ambulatory detox, which my understanding, I haven't heard of another one in this area anyway. There may be a couple in the state. Tell me a little bit about that and how that came about and what kind of results you're seeing with that.
The medical director at Oasis was instrumental in this because he was seeing that there was a large group of people who weren't getting served. As treatment has progressed and as we've gotten better at treatment, the medications we can use to treat people have also improved, and they're helpful. They make it easier for people to manage their addiction. So we've seen opiates as the primary drug of choice for those going into an ambulatory detox program. Largely they're underserved because so many insurance companies have said you don't need to go inpatient to manage your opiate addiction.
It's not life-threatening.
Exactly.
Which is, I've always struggled with this actually in the past, working in a hospital-based detox and making those phone calls with insurance companies. And when the response is it's not life-threatening, and my response is, do you have a son that's ever done heroin?
Right.
Do you know anybody? Is there anybody that lives on your street that's done heroin? Although they may not die, when you're talking about an opiate addict, if I feel like I'm going to die and I know what's going to stop that feeling, and I get one bad bag of dope, and it
will
kills
kill
me,
'em.
guess what? Now withdrawal from heroin has just become
Life-threatening.
life-threatening.
Yep. And that's one of the biggest issues, that we're having this huge void of people with a heroin or other type opiate addiction who couldn't get treatment, who just couldn't come inpatient to see us and do what they had to do, and a fear on the standard outpatient level where you can't give them enough. So we developed a program with the assistance of Oasis, where we have this ambulatory detox program where folks can come to our facility into one of our outbuildings. We have several buildings on our grounds. And people can come to this building and meet with a doctor, meet with a nurse, meet with a counselor, attend groups. And it's about a 3-hour per day program. It's almost like going to an intensive outpatient program. As with anything, I don't really see the point of just throwing a pill or a medication at someone's addiction. It doesn't get to the root of the matter.
Yeah.
It doesn't get to the heart of the problem. So you have to give the treatment. That's where we're focused, is giving them the group work, giving them individual counseling, giving them one-on-one time with a doctor, one-on-one time with a nurse to explain why it is you're feeling the way you're feeling, and why it is the pain you're feeling is really real to you, and how we can help manage to make that better. So it's really a program designed for the person who fits really in that valley between outpatient treatment and inpatient treatment.
So outpatient treatment, you folks have outpatient treatments, 5 or 6 of them: Schenectady, Troy, Glens Falls, Rochester, Plattsburgh, and Syracuse.
Right.
Tell me a little bit about the outpatient program, and what type of people do you see in the outpatient program?
Cover a lot of ground. So we have each clinic has their own little nuanced types of programs, but generally we're able to work with folks who have had a DUI. So we have DUI assessments. We have adolescents, and so we do adolescent groups and individual treatment for kids. We have medication management for those who need it. We have all the programs you can think of to help people manage their triggers, manage their people, places, and things. Let's go old school there,
Yeah.
That's one of those things that doesn't change.
Yep.
So our outpatient program, we have intensive outpatient, we have women's programs. We cover the gamut. We just, anything you need in the outpatient, we've got it covered in one or all of our clinics.
You mentioned the adolescents, and in particular the adolescent rehab. You have beds for adolescent rehab?
We do. We have a 20-bed program. It is it's actually a really nice program. So we have a school program,
Okay.
so kids can get their education while they're with us, and it's a 2-hour tutorial per day. So it's not like they're going in and doing chemistry labs or anything like that, but they're also not losing credits, which would be a relapse trigger if you go back to school. It's like, oh man, I'm 6 weeks behind in work. How am I going to make this up?
And there'd be a perfect excuse
go
for a
get
younger
high.
person also to not enter rehab. Well, I'm not going to go to rehab because then I'm going to have to repeat the
Right.
10th grade.
We take away the barrier.
An excuse.
Right. Exactly. So we have that component. We have group work tailored to the adolescents. We don't see our adolescents as mini adults. They are adolescents. Their brains are not developed the way an adult is. Adult men's brains don't fully develop, apparently, until they're about 25. My wife would tell you differently. So I bet yours would too.
Well, today's my 40th birthday, so I'm hoping, another 5 or 10 years,
Right.
would be good.
So we tailor it, though, to the brain development and the adolescent development that they're going in and what phase they're in their life right now. So a lot more intensive family work, because largely families are still involved. They haven't burned every bridge known to man yet. And we're trying to work with it so they don't. In a lot of ways, we see the adolescent program as a prevention program, knowing full well that they're here with us now, this is a great opportunity to prevent them from being a chronic drinker, chronic drug user, someone who needs to use this service for the next 50 years.
Yeah.
It's a nice opportunity to work with kids.
Now, with the kids in the adolescent program, what kind of family services and family program does Conifer Park offer? Because again, you know, everyone focuses on the 23, 25 million Americans that are suffering with addiction. What about the other 75 million, you know, that are living with the addict, that are married to the addict, that are a brother to the addict? So how does Conifer Park also simultaneously work with and treat the family? Because often my experience has shown me that the addict's not the only sick person.
It's just a small part of it. Well, maybe it's a large part of it, but nonetheless, Conifer Park has a family program, which we have a program that's simply for our adults, and another one that's simply for our kids and their families.
Okay. Trying
to keep them separated so that the adult issues and concerns stay with the adults, and likewise with the kids.
So is that so? Like, if someone's dad was in rehab, their kids could benefit
their
from services, and then if someone's kids were in Conifer Park, the parents could.
Right.
Oh, wow.
So we've definitely have adult patients who have kids, and their kids will come to the adult family program, and they'll learn about their role with the parents' addiction. They'll learn about how they can cope with the addiction. Some of the things that a lot of people who are adult children of alcoholics, they feel like it's their fault. Yeah. They feel like, what have I done to create this? So we work with that to take that pressure and that stress away, to feel like they have to own somebody else's addiction. So we work with the enablers, and we work with all of these types of folks, and so they have a better understanding of how to work their role within the family system and not get sucked into the addiction themselves.
The whole concept of the enablers, and everybody plays a role.
Absolutely.
And it was once described to me as it's like a mobile. Like if you have kids, the mobiles that you crank up, and hopefully your kid goes to sleep. The family dynamic of addiction, like when one person gets help, it's like taking a pair of scissors and clipping one of them, so now it's lopsided. So
that's a good way of thinking about it.
Let's talk about briefly the mental health component of addiction and how Conifer Park, what role that plays in regards to co-occurring disorders.
Right.
Because again, historically it was at times thought of, well, we'll treat your addiction, but you got to treat your addiction before we can look at the mental health. And then it was, well, we can't assess you for mental health till you've had so many days sober. So how do you kind of put those two pieces that I think individually, unless you put them together, your results are not going to be as good as if you treat them simultaneously?
You have to treat mind, body, and spirit. You have to treat the whole person. And this is a growing process. I mean, this is a process that's evolved for a long time. I mean, even in the almost 10 years I've been at Conifer Park, there's been a change. There's been an evolution in how we treat people with both mental health and substance abuse issues. They go hand in hand. I would have to say that in the neighborhood of 90% of our clients, if not more, end up with some sort of mental health treatment to go along with their substance abuse treatment. It is significant. There used to be this whole chicken and egg kind of a discussion about, what came first, addiction or the mental health problem. At the end of the day, with the thought process behind co-occurring disorders, it doesn't matter.
And it's very time consuming to try to figure that out. It doesn't matter. Like you said, what do we have right here, right now? How are we going to treat it?
Exactly. We have to treat what's in front of us today. And if you're able to go backwards and get to that stuff that happened in early childhood, or you're able to work forward so they can plan better for the future, that's fantastic. But right now, what's in front of you is what you have. And so if you have co-occurring disorders, mental health, and substance abuse, you got to treat the whole person for that.
Conifer Park does admissions 24 hours a day, 365 days a year.
Yes, sir.
That's just great.
It doesn't mean we see an admission at 2 a.m. on a Tuesday, but it's available. we absolutely, our doors are open. We're working 24/7, so if someone needs us, we'll be there.
Yeah. We actually have a clip that we're going to show now
Okay.
of an actual Conifer Park graduate, and he's going to share his experience and how his life has changed as a direct result of going through one of Conifer Park's programs.
Great.
Next thing I know is I just started thinking, what happened last night? What did I do? I had to go to work that day. I know there was a lot of celebrating because I know a lot of people won money at that party that I was at, and I just said enough was enough, and I was tired of being tired. I was so tired of waking up on the floor, so tired of not knowing what happened the night before. My body was worn out. I was just tired. So I decided that day when I went in that if I was asked to give a drug test, that I would turn myself in. And it was that day that I went in and was asked to give a drug test, just a random out of the blue. Coincidentally, and I just said this was the sign right here, right now, and I took advantage of it, and I told all to my dispatcher and to HR, and thank God for the programs that Price Chopper, the Golub family, have set aside for people with my condition that want help, because they were there for me, and it was amazing. It was an amazing process. I was scared. I knew that it was going to be a new life for me, and I knew it was going to be a better life. That's why I wanted to do it. I wanted to do it for my sister's family. I wanted to do it for myself most of all, so I could be on this planet just a little bit longer to give a smile, give a hand, help somebody out, see my niece and nephew grow up, meet my brother-in-law, and everything.
So you ended up going away for treatment. You ended up going, where'd you get treatment?
Well, HR sent me to a gentleman by the name of Dr. Bob, Dr. Bob Wishnoff, that Price Chopper deals with. And I went and seen him, sat down, he's a psychiatrist, I believe. But anyhow, sat down, talked to him, told him my whole story. And from there, he suggested Outpatient Services at Conifer Park in Troy. So I went there. I was there for a long time. I did hold my job for a while. They held it, but they suggested that for the first couple months or whatever that I seek help before I came back, and it ended up being a little bit longer than that because of the fact that I relapsed in rehab, and I regret that. I didn't take advantage of what my my counselor there at Conifer Park, he suggested self-help. They all suggested self-help, and self-help is something outside of rehab. AA, NA, they got a ton of programs for outside help, but it wasn't until I relapsed that I realized that I needed self-help, and that self-help was AA. I am more of an alcoholic than I am an addict, and they suggest going 90 days, one meeting every day to AA. I needed more than that. I felt as if that was my new home. I loved it, and that's where I wanted to be. And I went to probably about 120 to 200 meetings in 90 days because I had nothing else to do but to get sober and get better for myself. And I suggest that to everybody else.
So you're sober. You're sober now for how long?
Been sober now for 4.5 years.
Congratulations. Tell me how life is now sober. Since I got sober.
since I got sober, things have changed for me dramatically. I haven't had to start over anymore, which I did many, many times while drinking. I've lost everything many, many times while drinking and doing drugs. This time I know it's only material things, but I got tired of losing everything and then starting all over again. Today, I'm thankful. I'm in pretty good health. My liver's back to normal. They did tell me at one time my liver was in jeopardy, real bad, and they said that I had a 50-50 shot of my liver going back to its normal state, which it is now, and I got a great job. Been with the company now for a little over 9 years with Price Chopper. Been driving truck. I can say that I'm happy there, and got a brand new truck. I got a beautiful soon-to-be wife, awesome stepson and stepdaughter to be, and I'm where I want to be in my life right now.
So again, I want to thank Bill DeJoy, Clinical Director of Conifer Park. Bill, in the last few moments, the last word, if someone's watching and thinks they may have a problem or know someone that may have a problem, what advice would you give to them?
Reach out. Absolutely reach out. Talk to someone. I don't care if you're talking to your family, someone you love. Reach out. Talk to someone. Our phone number is 1-800-989-6446. You can ask to speak to one of our admissions folks. We'd be happy to help. You can go online to www.coniferpark.com. You can do our test, our little screening tool, figure out what you got going on. There's a link on there, and we'll have someone call you back. Reach out. We'll be happy to help you.